Good evening, everyone. Can everybody hear me? Okay. So I'm going to talk about health shouldn't hurt, bridging the women's health crisis. So for far too long, women's health and women's health care in this country has been an afterthought, undervalued, underprioritized, under-researched. The results? Countless women dismissed, misdiagnosed, or left without answers, all because the system was not built with women in mind. Women represent over half of the world's population, and when half of the population is left behind in healthcare, everyone suffers. So I'm going to take you with me on a journey to tell you the story of three women, Anna, Linda, and Nina. So I'm going to start with Anna. Anna is a 24-year-old woman who lives in a small rural community. She's very excited when she gets pregnant with her first child. She has to travel 40 miles to get her prenatal care. 9 months go by, she goes into labor, and she still has to travel those significant 40 miles to get to a small rural hospital. She gets to the rural hospital, she delivers a healthy baby. However, a few hours later, Anna develops severe hemorrhage. In spite of resuscitative measures, by the time they could transport her from a rural hospital to a tertiary care center, it was too late, and the little baby was left without a mother. Did you know that United States has the highest maternal mortality of any developed nation? 22.3 deaths for every 100,000 live births. And if you happen to be a Black woman, your risk is 2.5 times higher. And for every death, there is probably about 50 to 100 misses, near misses. And this is the truth. 80 to 90% of these deaths, depending on which county and which part of the United States you're from, is preventable. So you ask this question, if that is the case, why are we having such high mortality? And I will highlight a couple of issues. The first is access. About a third of the US counties does not have obstetricians or gynecologists or primary care providers who can provide prenatal care. We have significant obstetric deserts in this country. And what that means is that rural communities, rural areas are closing down obstetric practices, and therefore these lead to huge obstetric desert. The other issue is lack of coordinated comprehensive care for these women, especially in the postpartum period. Majority of the deaths occurs in the postpartum period. Postpartum depression is real, but it's usually ignored and misdiagnosed. And so having a coordinated, comprehensive postpartum care that goes far beyond the first 8 weeks of a mother's visit to the doctor's office is going to be very important as we look into the future. So our health system failed Anna and mothers like Anna. So now let me talk about Linda. Linda is a 46-year-old marketing executive in corporate America. She's dynamic, she's articulate, and she's smart. Over the last few months, she has noticed increasing night sweats, hot flashes, and she's noticed increasing fatigue and brain fog. She finds herself forgetting names, she finds herself missing deadlines, and her confidence starts plummeting. She feels she's losing her edge. And she's really pushed over the edge when her boss asks her, "Do you want to step down from what you're doing?" Nobody asks her, "Are you going through menopause? Or do you know that we have resources available for you for the treatment and diagnosis of menopause?" Did you know that menopause-related absenteeism in the US costs the economy $1.8 billion annually? And people like Linda, it is important that we highlights our need to say that this menopause is not just a personal journey that every woman has to go through. It is a healthcare issue, it is a societal blind spot, and it is a workplace issue. So why do we have these problems? Education. In spite of menopause being an important aspect of a woman's health, less than a third of the obstetrics and gynecology residency program talk about menopause in their curriculum. Less than a third of the residents get training in menopause clinic during their course, so we have some major gaps. Second is lack of research in the area of menopause, not only talking about why we have the biological changes related to menopause, but also why is it so different. We talk a lot about breast cancer, but what we don't talk about is the induced menopause that happens to women with breast cancer, and that they have to survive those menopausal symptoms even though they are considered survivors. That's a journey nobody talks about. And in spite of menopause being this issue for over 20 years, there's been hardly any new drugs which have come on the market, even though we're beginning to see signs of new drugs coming in. So again, the system is failing women now in midlife. So now let me talk about Nina. Nina is a 34-year-old mother of 3 children. She works inside and outside the house, and she is also the caregiver of her elderly parent with dementia. Over the last few months, Nina has noticed that she's been having worsening headaches, joint pain, and chronic fatigue. She goes to her physicians and multiple primary care providers who say this is related to stress, you're doing too much, maybe it's depression, and some even say, are you trying to get out of work? After 4.5 years of going to multiple healthcare providers, Nina is finally diagnosed with lupus, an autoimmune condition which impacts women disproportionately differently than men. So did you know that in the United States, on average, women have 9 years of their lives in poor health or low quality of life? That is almost a decade of decreased productivity and poor quality of life. So Nina's story is a call to all of us to think about women's health beyond reproductive and sexual health. The first comment that I usually receive when I talk about women's health is focused on reproductive health or sexual health. But the truth is, the health burden related to reproductive and sexual health contributes to only 5% of the women's health burden. 47% of the women's health burden really comes from conditions which impact women's health differently or disproportionately. So why do we have this problem? The women tend to be misdiagnosed or underdiagnosed or mistreated because the clinical trials and research that we have is predominantly based on men. And that leads to inherent biases that we have within our healthcare system and critical all our evidence-based guidelines. In a recent journal, in an article that came in the Journal of American Medical Association, when they looked at over 1,100 clinical trials, they found that women were underrepresented in most of the clinical trials, especially as it related to heart conditions or acute coronary syndromes. So women are underrepresented in research. There was also another interesting study which looked at 13 high-income countries. And they found that the women in the United States had the worst outcome when it came to insurance and healthcare accessibility. And women in this country are more likely to be left out of diagnosis or underdiagnosed because they cannot access healthcare due to cost and affordability. And of all the 13 high-income countries, women in this country had the worst healthcare outcomes. So, in summary, I would say that over the last few years, women's healthcare has been an afterthought. But when we invest in the health of women, we not only make a difference in their lives, we actually strengthen families, we strengthen communities, we strengthen economies, and we strengthen the future of this country and the world. So what can we do to make a difference and help close the women's healthcare gaps? So I would kind of talk about 4 main pillars. The first is investment in research. We need to be investing in research, not just to talk about looking at understanding the biology of women's health, but also to make sure that we have a systematic approach in which women are included in clinical trials so we can get data that can help us close the healthcare gaps. Number 2, we need to invest in education. And when we talk about education, it is across the continuum, starting with the primary care providers and the obstetricians and gynecologists in the medical school to help them understand what it is to be taking care of women's health. It is important that we educate women and increase health literacy so women can be empowered to talk about their health, and needs to be done in a culturally sensitive manner. We also need to be educating our communities and our workplaces to understand the special and unique needs of women's health. In fact, there was a survey which was done by Bank of America in 2023, which showed that organizations and corporations and corporate worlds which invest in women's health at the workplace had better retention, increased productivity, and more women were being promoted in the workplace. Third, we need to invest in innovation. Innovation is a common term. Everybody talks about innovation. But I also look upon innovation as what are the things we can do differently than what we are doing today. I think we need to innovate in clinical care, and that's first and foremost. Clinical care to provide a coordinated, comprehensive, evidence-based approach across the continuum from birth to death. We also need to invest in clinical care models that can provide the physicians and the primary care providers and the healthcare providers tools so that they can provide personalized, preventive care to these women. We also need to help close the access issues by investment in telehealth, by investment in digital tools that should be done in a human-centric design approach model so that it is actually user-friendly and can facilitate them engaging with the healthcare system. And finally, we should also be looking at AI and some of these machine learning, looking at large data to identify gaps in women's health so that we can actually put in research dollars or other resources to help close the gap. And finally, it's important that we invest in advocacy and policies. So the policies needs to safeguard access to essential services. We should also make sure we have policies that focus on removing the geographic, financial, and systemic barriers to healthcare that women face. We need to promote for access and advocacy in research equity so women can participate in clinical studies. And we need to advocate for workplace policies to provide resources and support for women. Because when we invest in women and when we help close the women's care gap, by 2030, this was a study which came in McKinsey report. If we invest in them, 3.9 billion women will have better health. And it returns to the economy over $1 trillion of economic productivity. So think about it, 3.9 billion women and over $1 trillion coming back into the economy because we are helping close the women's gap. But ladies and gentlemen, this is not about statistics. This is not about numbers. This is about your mothers, your wives, your spouses, your daughters, your granddaughters, your colleague at work. It is your community. So I think it is time that we make the invisible visible. Let us all value what we know is invaluable. And the only way we can do this is by doing this together. And that's kind of a journey. We are starting here at the University of Illinois College of Medicine, Peoria. Thank you.